Hello, I am Matthew Loscalzo from the Moores UCSD Cancer Center in San Diego, California. The Moores Cancer Center is one of only 39 National Cancer Institute comprehensive cancer centers. That's a special designation. That means that we have been designated to do research, clinical care, and education about cancer. So this is a very exciting time for us to be able to talk with you about some of the exciting programs that we do there. One of the most important things that we do there, of course, is that we do have sign interpreters available to all of our patients and their families, but you have to ask for it. Part of my job is that I have the honor to be the Director of Patient and Family Support Services. In this role, I'm able to work with doctors, nurses, social workers, psychologists, patient educators, and many others to think about what patients and their families need so we can humanize the experience, enable people to fully benefit from the medical care that we can give, and to provide the information and help with decision making that all patients and families need when they find out that they have cancer, a very serious illness. Right. And I want to thank the caller for this wonderful question. And what they're asking is, what are some of the first things that people should do when they find out that they have cancer? This is a superb question. This is a very commonly asked question. The first thing they should know is that it is normal to feel overwhelmed by feelings. It's normal to feel a certain level of shock, confusion. It is normal to even think this cannot be happening. It takes at least 7 to 10 days for one's thoughts and feelings to become integrated. But virtually all people do cope, do manage, and it's essentially the same for the family as well. So the first thing you should know is there will be a time when you will feel confused and overwhelmed and scared. That is normal. But what you need to do is you need to take that fear and to turn it into action. You need to call people who you care about, with whom you can communicate, who you feel emotionally connected to. You then need to talk with your doctor and nurse to get the special information that only they can give you about your situation. It's very important, though, that you find a doctor with whom you can communicate and who you trust. That's always the first step, because this is the person who will be guiding you through your cancer experience, especially at this time when most cancer patients will be cured, and those who will not be cured will live for very long periods of time. This is an exciting time in cancer when we are curing many cancers and enabling people to live fuller, better lives even with cancer. So it's always important to find a team, family member, friends, and your healthcare team, and always get a second opinion. Your doctor and nurse would like you to always get as much information to be as fully informed as you can. And we're going to talk a bit more about this as we get to some of the other questions, I'm sure. The next question, please.
Yes, it's a question from Anita in Minnesota. If a doctor tells me that I have cancer, what types of questions will I have to ask them?
This is a superb question because it really gets to what people have to manage. As you know, cancer and its treatments are very complex, so it's important to have up-to-date information about your specific cancer and what's happening now in terms of treatment. The first thing you need to ask your physician, your doctor, and your nurse is to say, what should I know about this particular cancer? To ask them, what kind of cancer do I have? And with cancer, it also helps to know what stage it is. So your doctor should be asked, tell me what's important to know about my specific situation. It's also important to ask, what is the outlook? What's the normal course of this specific cancer? The word that's commonly used is prognosis. What's the expected course of the illness? And that will give you some sense of not only how long your treatment will be, but what are some of the specific characteristics of this particular illness, because that will impact. on the kind of treatment you have, how long it will be, and how disruptive or not disruptive it will be to you and your family. So it's important that you begin the dialogue right away. But probably the most important thing you can do at this point is to let your doctor know, for you to tell your doctor how you take information and find it most helpful to make decisions. You have got to take responsibility to educate your doctor and nurse and to tell them, I'm the sort of person who likes all the details, or I'm the sort of person who just wants to be told what I should do and I will do it. And this begins a conversation of not only medical treatment, but of healing, and being able to build trust that you will need over the oncoming months in coping with cancer and its treatment. It really is very helpful, though, when you speak with your doctor, to make sure you have someone with you who you trust and who you know will be able to hear the information. It's extremely helpful to take notes, to write things down. It's extremely helpful to have the other person ask questions as well. And we also highly recommend audio taping, so you can have someone listen to that information and to share it with you later. It's very important to think in as many ways of thinking, of seeing, of asking questions, of thinking through, because that first session with your doctor will create an environment that will have implications for how you'll work with them throughout your illness and your treatment. It's very important for you to take responsibility to say, this is how I make my decisions. Help me to do that in my way. And most physicians will help you. I think we have one more caller now.
Yes, it's a question from Ellen from Chicago. The doctor just told me that I have cancer. I'm very, very close with my family. However, I haven't told them yet. How do I breach this subject, and how do I tell them?
This is one of the most common questions that we are asked. Men will often say, I do not want to tell my family because I need to protect them. Women will sometimes say, I do not want to tell my family because of the disruption that it will cause them, and I should be taking care of them. This is a very difficult situation, and the number one thing that any family must have is honest and open communication. You must open your heart, open your mind, and go to tell them. One of the things that I tell family is, if another member of your family was ill, how would you feel if they did not tell you? So fear is normal. Everyone, when they find out that they have something different with them, and cancer is certainly a serious illness, they would be afraid. They would have fear. But with that fear, it should enable you to move closer to your family, and that can only happen within the context of honesty and open communication. So you should go to them and say, I've had some news, I've been told I have cancer. And then ask them what they understand about cancer. And then you might want to have your doctor and your nurse meet with them with you, so you can have a second opportunity to ask some of the same questions you may have asked or forgot to ask the first time. But always remember, your relationship with your family is ongoing as it is with your healthcare team. You may ask the same questions over and over again, and that's normal. We encourage you to do that. And we have another person on the phone. This is wonderful.
This is from Barb from Florida. My husband and I went to the doctor, and my wife has cancer. And it really struck me, my husband has cancer, and it really struck me hard. And I'm not really sure, do I tell my husband how I feel, because I'm not dealing very well with it?
That's a really wonderful question, and a very common question. And it goes right to the heart of who we are as human beings. There are very few things that we can say in large general terms about women and men, because they're so different. Many women feel that it's their responsibility